If you're getting close to retirement, you may be trying to figure out how Medicare fits into the full picture of your medical coverage. Medicare Part B will be an important part of that process because it covers a wide array of health services. Hi, I'm Tricia Sandiego. Part of my job at AARP is to help people understand how to get the most out of Medicare. So, how does Medicare Part B work, and what are the costs? Let's start with some basics about what's covered. Medicare Part B is the part of Medicare that covers doctor visits and anything that doesn't require a hospital stay. It also covers preventive care, like wellness visits or flu shots, lab services, like blood tests, diagnostic tests, like MRIs or mammograms, medical equipment, like wheelchairs, oxygen, and transportation, and some home health services. Just like insurance under your employer, some of these preventive services and screenings are covered on set schedules. Typically, preventive services do not cost you anything out of pocket. However, if your doctor runs a test to diagnose or treat a disease or condition, you will incur a cost. Speaking of costs, you're probably wondering what's free and what you'll pay for under Medicare Part B. No problem. I'll start with services that don't require any out-of-pocket costs. For example, wellness visits. That's all your regular doctor checkups. These include breast exams, colorectal and prostate cancer screenings, as well as some other tests and vaccines based on your age and risk factors. Now, to out-of-pocket costs. Even though Medicare Part B covers many of your expenses, you will have to pay a premium, a deductible, and when applicable, coinsurance. Part B has a monthly premium. It's either deducted from your Social Security benefits check or you pay it directly to Medicare. The amount you pay can vary depending on your income. Each year, you'll also pay an annual deductible before most Part B coverage begins. The amount of that deductible is set each year. You'll also pay coinsurance. It's about 20% of the cost of most doctor visits that are not part of your wellness visit. Let's look at an example. Say you go to a specialist to get checked for stomach pains. They charge $500 for the visit. Medicare would pay $400, or 80%, and you would pay $100, which is 20%. Now, say your doctor finds something during a screening that requires additional treatment. Medicare would cover the screening, but you may have to pay extra for services such as removing a polyp during a colonoscopy, for example. Be sure to contact Medicare to find out if the services needed are covered. And when it comes to out-of-pocket expenses, you may want to consider buying a supplemental insurance plan. You can find more about that in this video's description. If you need financial assistance, you may be eligible for a Medicare savings program based on your income. I hope this video helps you understand your Medicare Part B coverage and gives you the knowledge you need to make an informed decision. For more helpful information, visit aarp.org/Medicare. Please take a moment to subscribe to our YouTube channel so you don't miss out on future videos like this from AARP.